Once the diagnosis of hypochondria has been established, how is it treated?
Well, there are a couple of ways you can treat it. Cognitive therapy uses that rational part of the mind that we talked about to actually isolate. You sit with the patient and isolate each one of these false beliefs and subject it to the patient's own rational way of thinking. You do it even when you're not in the therapist's office. And you learn to do that when these worries and these fears come up. For instance, you're at the doctor because you think you have some, horrible illness because you're a little short of breath. Well, you know rationally that there are a heck of a lot of things that can cause you to be short of breath, and most of them aren't a serious illness.
But if you're all wrapped up in this worry, how do you do that? How do you reach through the worry?
Practice.
Really, is it?
Yeah. You learn to practice, and eventually it's a skill that you learn on your own. Meditation and biofeedback are good for anxiety in general, so to the extent that this is making you anxious, they're going to help, but there's nothing specific about them for this particular
What about
disorder.
medication?
Medication, the newer antidepressants, the serotonin reuptake inhibitors, are very good at alleviating this. There are stimuli in our society that we expose ourselves to that make us more likely to become hypochondriac.
Like, for example, what?
Well, like, for example, all this direct-to-consumer advertising on TV. Do you have depression? Do you have fibromyalgia? And so on.
Do you have erectile dysfunction?
Do you have erectile
You never thought about it before, but suddenly
Right.
you think, well, maybe
now,
I do.
Now you start to worry.
And there's
then,
a pill for it, so I might as well have it so I can buy the pill.
Right. Does the internet contribute to hypochondriasis?
I think it contributes to a general anxiety about disease in our culture. The internet is like a doctor that never kicks you out of his office. He's there 24/7. He's
Great.
there
Something
for
else
you.
for you to worry about.
He's there for you at 2 in the morning.
And that's really one of the big problems that I have with my patients who dive into the internet to try to find information about their illnesses, and they come to me and they're all
Quantity,
discombobulated.
not quality.
One of the things I can do is to direct them to a good site, or to say, okay, let's talk about it. What are you bringing in terms of information? Let's figure that out.
So you have to, put yourself in the position of somebody who doesn't have however many years of fine education that you gentlemen have. And then there was the other 2 that didn't go so well. But if you don't have the expertise and somebody calls you up and says there's a spot on your kidney, and I'm sitting in front of a cubicle, of course I'm going to go.
I totally understand that. And contrary maybe to popular belief, we do not sit around making fun of our patients who are hypochondriac or complain of things. You really don't. I mean, it's tough to wade through all of the mountain of information out there, try to figure it out, what's important, what's not.
Lest you think being a doctor makes you immune to hypochondria, I once had a piece of dirt removed from my skin by my dermatologist because I was convinced that it was cancer.
Right.
So,
but he didn't know it was a piece of dirt. He said, "What's this?" And the guy goes,
Psychiatrist, heal thyself, or analyze thyself.
And I had some tingling in my toe when I was a medical student. I went to the neurologist, and he said, "All right, what do you think you have, MS?" And I said, "Actually, I hadn't thought of that, but now I'm a little bit worried."
These are great admissions.
I thought I had
I feel
pinched a
better
nerve.
already, doctors. Thank you.
All right. So I think that's just about it. I think we've covered everything there is to know about hypochondria. And what's the final diagnosis, Richard? Is he a hypochondriac or is he not a hypochondriac?
He's not a hypochondriac, despite his best wishes. He's the worried well.
The worried well. All right. Well, may you stay well. Thank you so much for joining us. Thanks so much for you joining us. And try to stay well without being worried. I'm Dr. Jon LaPook for CBSDoc.com.